The technical term for TMJ is temporomandibular joint. It basically describes the bones that are in the jaw joint. You have the temporal bone, which is the bone on the side of the face, right where your temples are. And then you have the jaw bone, which is the mandible bone, which is your lower jaw bone. And so you put those two together, you get TMJ, temporomandibular joint. TMJ by itself is really considered to be the great imposter because it comes in so many different varieties. You could have sinus headache, you could have migraine, you could have popping in the jaw, you may even have limited jaw opening. All of these things have been connected to a classic TMJ dysfunction. And because they come in so many varieties and in so many forms, it's sometimes hard and difficult to determine if it really is a TMJ problem that a dentist can treat. The area of treating TMJ dysfunction is a continuing, expanding area of learning for me. So many people have a problem with their jaw joint that is not easily recognized in the medical community. We're also beginning to learn that sometimes the jaw joint is just secondary to something that's even more menacing, and that's obstructive sleep apnea. What obstructive sleep apnea does, besides making us sleepy and drowsy and making us more dangerous while we're driving, it causes us to clench and grind our teeth during sleep, which in turn loads the jaw joint, and when the jaw joint gets loaded, it wears itself out. The muscles get sore, the tendons get sore, and you get your classic TMJ problem with that. I want the people that we treat to feel comfortable, and I want them to not be afraid of the dentist. The majority of people are fearful to some degree or another, and if I can overcome their fear and help them get back a smile that they've lost, or repair a tooth that's hurting them, or replace a missing tooth that bothers how they feel about themselves, that's where I get my joy in providing that kind of care.